Assalamu alaikum wa rahmatullahi wa barakatuh. This week we will have a study done by Thai group, which is a Mahidol study part 2, titled as Treatment Outcomes and the Prognostic Factors of Regenerative Endodontic Procedures in Immature Permanent Teeth. It's published in Journal of Endodontics in 2024. It's a retrospective analysis combining data from two phases, which is part 1 and part 2, to increase sample size and extend the follow-up period. In the part 1 or phase 1 study by Jurofan et al. In 2012, no significant prognostic factors could be identified due to the small sample size, and most previous studies on regenerative endodontics had small sample size and short-term outcome. This study aimed to evaluate treatment outcomes, which is periapical status, root development, and response to sensibility test, and identify any prognostic factors of this procedure in immature permanent teeth. Data collected from patients treated with regenerative endodontic in the endodontic postgraduate clinic pooled data from 20 cases from the part 1, which was done in the period from 2006 to 2009, and 100 cases in the part 2, which is 2010 and up to 2023. They included necrotic immature permanent teeth, with or without periapical lesion. Also, teeth included were negative respond to APT or core test, and teeth with irreversible pulpitis that were bleeding could not be controlled, and any case should have minimum recall period of 12 months. They excluded cases with insufficient clinical or radiographic data. Several data were recorded: preoperative, intraoperative, and postoperative. Regarding the clinical and radiographic assessment of outcomes, the primary outcome of the regenerative endodontic comprised functional retention and the success rate. Functional retention defined as the tooth remaining in the dental arch without clinical signs or symptoms, regardless of periapical radiolucency. They categorized the outcome based on healed, healing, or disease. Healed if there is no clinical signs or symptoms and no periapical radiolucency. Healing if the periapical radiolucency reduced in size with no clinical signs or symptoms, and disease defined as presence of clinical signs and symptoms and persistent or increased radiolucency, or developed a new periapical radiolucency. Regarding the success rate, they based on strict criteria, which is only healed were defined as a success, while healing and diseased teeth were classified as failure. For the secondary outcome was related to continued root development. They observed the changes in the radiographic, including apical diameter, root length, root width. Also, the tertiary outcome was about the sensibility test, or the response of the treated teeth to the sensibility test. Moving to the result, they had 120 teeth were included in this study with an 85% recall rate. The follow-up period ranged from 12 months to 148 months, with a mean of 41 months. In this study, approximately 2/3 of the patients were younger than 12 years old. Overall, the healed rate was 80%, and the healing and disease rate were 9 and 10 respectively. In addition, the functional rate was 97%. The multivariable Cox proportional hazard model analysis revealed that patients aged older than 12 years and immature root formation stage 3 were two significant factors for disease. Moreover, patients aged older than 12 years with stage 3 root formation demonstrated a significant higher risk for disease compared with the patient aged younger than 12 years. However, the risk in the older a 12 years age group with stage 4 or 5 root formation was not significantly different from that of the group younger than 12 years. The multivariable linear regression analysis revealed that younger patients showed a significantly greater increase in apical diameter, root length, and root width compared to older patients. Additionally, the etiology of pulpal disease from dental caries was consistently associated with a greater increase in all three parameters compared to dental trauma cases. Teeth with the stage 3 root development demonstrated significantly greater increase in root width compared to those with the stage 4 or 5 root development. The concentration of irrigant also played a significant role, with more than 2.5% sodium hypochlorite showing a greater effect on the increase in root length compared to lower concentrations. Regarding the pulp sensibility, the positive response rate to cold test or EBT was 41%. Also using EDTA irrigation before creating a blood clot and the capping material level at or above the cemento-enamel junction were the two significant factors for response to sensibility test. So we can conclude from this study that the 97% functional retention and 80% healing were observed in the 120 teeth treated with regenerative endodontics. Continued root development was noted in apical diameter, root length, width. Also 41% of teeth responded positively to sensibility test. Patients under 12 years and those with caries showed better healing and root development. EDTA irrigation and capping material level were significantly improved sensibility response. Thank you.